Hello everyone. Welcome to Learnings on 24 into 7. So here Deepa, your trainer. So in this session, we are going to discuss about fall prevention and management. So we all are aware that fall is a major concern or an error which is occurring in our hospitals, no? Including the patient fall, maybe the attendant fall, or even the employee fall. Like different types of falls are there. And which is a major concern, no, because it's purely a nursing quality indicator, no, if the patient fall, because patients are assigned to us 24 into 7, and that's why if a fall happens, the assigned nurse is much more bothered, no. So in this session, which is a very brief session, we are going to discuss about how to prevent a fall, and once it happened, what to do. Okay, so shall we move to the proceedings? So here, our screen. So fall prevention and management. We all are aware about the IPSG's International Patient Safety Goal. IPSG 6 says, reduce the risk of patient harm resulting from falls. Okay. So first of all, who all are the vulnerable patients? Vulnerable means the patients who are at risk for certain kind of incidents or more harm, no? So it is age may be different for your hospital, but usually patient aged more than 65 years, which we are considering as old age. And this old age patients, all these old age patients, we are considering them as a vulnerable patient. Then the patients aged less than 15, which comes under pediatric age group. Then all the patients admitted in the critical areas of the hospital. Usually, the patients who are admitted in the critical areas may not be able to perform their routine activities, or they are not able to actively participate in the decision making or treatment protocol, whatever it is. So usually critical areas, the patient admitted in those areas, we used to consider them as vulnerable patients, no? And those who are physically, mentally, or emotionally challenged. Then those who cannot perform their activities of daily life. And woman in labor, or the woman who is undergoing an MGP, medical termination of pregnancy. Then the terminally ill patients. And those who have suffered from acute or chronic pain. Okay. Then victims of abuse or neglect, infectious patient, which is of course communicable, or those kind of infections. And the patients having chemotherapy or immunocompromised drugs. So these kind of patients, usually we are considering all of them are vulnerable to different things. These people are vulnerable to a medication error, no, because they are not able to actively participate in the decision making process, or they are not able to understand the process fully because they are not in that kind of a state. So, and fall, same. And like many different incidents or harmful situations, these people are vulnerable. Now, what all are the causes of fall? How it happens? So majorly we all are telling first thing is the medication. Yes, the patient is under some sedative medication, sedative drugs, or after, in the post-operative period. So these patients are at risk for fall. Secondly, age. Age already we discussed in the vulnerable category also. So age is also second chance or second thing which can lead to a fall. Then the disease condition, like, like they are not able to concentrate, or any balance change diseases, these kind of things can lead to a fall. Then wet and slippery floors. Usually, we used to keep, whenever we are seeing a wet floor or slippery floor, immediately we need to try to dry it and keep it properly, no? Otherwise, patient or anybody can slip and get a fall. Then fully occupied rooms. This is another concern. See, whenever so much of furnitures are occluded in the room, and that is not in their own positions, then patient can have a just tucked in between and can have a fall. Okay, a room with no order for keeping the things, almost same only, and bed that is not locked. We all are using the beds which is having the wheels for the easy transportation and all. But once we just transported, or we just kept the bed inside the patient room and we didn't lock the wheels, then whenever the patient is moving from the bed, they can have a fall. No grab bars. grab bars, I hope all of you are very familiar with, like in the washrooms or somewhere where, where the patient, see physically handicapped patients and all, usually in the public areas also, for this kind of people, there are a grab bars, no? So same kind of grab bars in most of the hospitals nowadays it is there, so that the patient, when they are starting from the room to the washroom, there are in the side or the wall grab bars are there. So that is the grab bars. No grab bars can lead to fall. And inadequate light. Inadequate light, usually the nighttime and all, most of the patients prefer to sleep in complete darkness. But usually hospitals are not advised the patients to switch off all these lights, no? At least a 0-volt bulb or minimum light bulb should be there, so that whenever they are waking up or whenever they are trying to move, that light will help them. If it is a complete darkness, it can lead to fall very easily. And major concern, improper education. See, we know all these things, but if our patient don't know all these kind of things, definitely they will try to wake up, run away to the washroom, and they will land up in a fall. So, patient family education, which is a clause in the JCI or NABH accreditation processes. So this proper education is very important to prevent the fall. See, we need to tell them about the orthostatic hypotension. Usually patients, they all are lying down. Immediately they are changing their position and they are having they might be having a orthostatic hypotension, which we are also feeling or facing. So this orthostatic hypotension can make them to fall down. So you have to educate them just to sit down. Whenever you are lying down, don't stand up as a sudden. Just sit down for a moment. Just move your toes. Okay. Then stand up. See that you have the balance. Then only move. So this education we have to give to them. And we need to tell them, grab bars are here. You can utilize it because they might not be knowing. No. And call bell. So you should tell them clearly that this is the call bell. Don't come out of the bed by yourself. Whenever you need our presence or whenever you want to move or wake up or out of the bed, you want to move, please call us. Okay. So never ever allow the patients, especially for vulnerable, to move alone, no, out of the bed. Now the another one is no side rails up, which is a common thing. Majorly, our patients, most of the patients are saying, yeah, I am okay, I am not comfortable in this side rails, this, that, 100 reasons, no? And we are also least bothered. Whenever like we are going for a rounds and all, many of the side rails are just lying down only. I just want to tell you one thing. Many of you might be traveled through an aeroplane. So whenever that seatbelt symbol is coming, fasten your seatbelts. None of us are sitting without a seatbelt. No, why? Because we know our safety. And all the, flight attendants or the air hostess, these people are coming and they are telling us, sir, mom, please fasten your seatbelt. And none of us are saying no. No, I am not interested. I am not comfortable with seatbelt. Why? Why? Because one is the customers, that people who are flying, we are aware about the policies and protocol. No. Secondly, the people who are asking us to do so, they are communicating in a thorough professional way, where in our situation, most of the time, we used to fail to communicate in a very professional way. That's a major reason. See, many of the times I just visualized or witnessed that people are telling, Uncle ji, upar kar lena. What professionalism is there in that? We already discussed one topic under communication, no? So that professionalism matters. And when we are educating like orthostatic hypotension, these technical terms in their languages, they will respect us. Okay. So whenever you're communicating, we have to talk to them in thorough professional way. Otherwise, they are not going to listen to us. They're our customer. Introduce themselves. It's our policy. Your safety is in our hands. So you may please keep the side rails up. Whenever you want to go out of the bed, please call us, sir. Okay, and don't try to remove the side rails by your own. That can cause a fall. And if a fall happens, it can be different. I'll be explaining the sentinel events or adverse event, all these things later on. So you can tell them if a fall happens, it can be a minor fall or it can be a major fall. So you may increasing the length of your hospital stay, you may get fractures, even you can be in a coma. So sir, please understand the seriousness and please cooperate with us. Like this, if you are educating them in a professional way, definitely they are going to listen to you. So these are major causes for fall. Now, how to prevent a fall? So all of the hospitals are using vulnerability assessment. No, that is we are assessing the vulnerability of a patient for a fall. So we are using different scales. No, some of the hospitals, most of the hospitals are following Morse or modified Morse-Fodder scale. And for pediatric Humpty Dumpty scale, there are so many other tools to assess the vulnerability or risk of fall. So whenever a patient comes to the OPD or even to the IPD, we are immediately, as part of our nursing assessment and all, we are just assessing the risk of a particular patient to get a fall. No, so this here it is Morse fall assessment scale. Okay, so in this, like you can see 6 different parameters and we are scoring numerical value we are giving to each of this parameter. And at the end, we are adding all the score and then we are finding out the total score. So the first one is history of fall. If a patient is having a history, like this patient had a history of fall in the last 6 months or something, then the patient will score a score of 25. Okay, here 25 they'll score. And if no history, then it will be 0. So we will write the score in the next column. Then secondary diagnosis. Secondary diagnosis, that means the patient is admitted with a diagnosis. Other than that, some related diagnosis. For an example, CVA patient. CVA patient is having a history of hypertension. So that is the secondary diagnosis. Okay. So if a patient is having a secondary diagnosis, score will be 15. If no, then it will be 0. Ambulatory aid. Ambulatory aid means the aid, help the patient is receiving to get ambulated. So none. Bed rest or nurse assist. The patient is not moving, so it will be 0. Crutches, cane or walker patient is using, then it is 15. And patient is holding the furnitures and moving, then it is 30. Then IV access, 0 or 20. Gait means the position or stature. The normal, bed rest, wheelchair, then weak or impaired. So based on that, you will be giving the scores. Then the mental status. So you're giving 10 or 15. So your scores for each parameters will come here. And at the end, you will add all these parameters and you will getting a cumulative score. So if this cumulative score is in between 0 to 24, it will be low risk. We will consider it as low risk. Okay. And if the score falls in between 25 to 44, we will consider that patient is having a moderate risk. And if the score falls more than 45, then we will consider this patient as a high-risk patient for fall. So this is a Morse fall risk assessment scale. Like this Marian-Joy fall risk assessment tool. So many assessment tools are there if we are Google and we are using it. But usually, as of my knowledge, in our areas, in India and in our Delhi NCR and almost all the areas, we are using this Morse fall risk assessment scale or a modified Morse. We will call it in different names according to our hospital policies. But almost all the hospitals are using that 6 parameters and Morse fall risk assessment scale. If you want to further reference or something, you can just go through this Marian-Joy fall risk assessment tool just for an information I'm telling. Okay, like this, same for the pediatrics. Pediatrics, most of the hospitals are using a Humpty Dumpty scale. See, Humpty Dumpty sat on a wall, Humpty Dumpty had a great fall. All that we all learned in our childhood, no? So like for that, Humpty Dumpty name is given to the fall risk scale for the pediatric age group. So it is having 6 criteria like age, gender, diagnosis, cognitive impairment, environmental factors, response to surgery, sedation, or anesthesia. So there are categories: less than 3 years, like age-wise score. Then male, female, considering that male kids are more vigorous, maybe. So they are also scoring. And the diagnosis basis, which what is the major system affected? Then the cognitive impairments, environmental factors, and response to the surgery or sedation or whatever it is. So like that, here also we will score the cumulative score and we will consider the baby as vulnerable or less vulnerable. Now, how to prevent? Already we discussed the reason. So if we know the reason, we can prevent it very easily. So see, side rails up, major thing. Side rails or seat belts. Whenever patient is moving, seat belts up. Never left unattended. Okay. We are usually not allowing any of the patient to be inside the hospital without an attendant. So never left patient unattended. If nobody is there or vulnerable patient, every time I emphasize them that get an assistance when getting out of the bed, even if an attendant is present. Okay. So vulnerable patient, make it mandate. Now, slippery floors. So keep, whenever you are noticing or somebody is telling you floor is slippery or water is there or whatever it is, immediately put a caution board that that cleaning is in progress. This kind of boards we are having, or slippery floors board we are having. Immediately put a board and clean the area at the earliest. Accompany whenever needed. Okay. Seat belt on while moving. And call bell within reach. Otherwise, patient will extend to get a call bell and patient can land up in a fall. Adequate light in the room. Special monitoring after sedative medications. Then, education. So just want to share one incident with you. See, all these things we discussed. One more point I just want to add. Always tell the patient, do not lock the doors of the washroom. Okay, so you can tell that we will not, none of us will come inside. We will be just standing outside if they are not comfortable. Okay, so and tell them never ever put the lock. Once in a hospital, one incident happened in one of the hospitals in Delhi. And, one patient, he was like around 30, 35 years old and admitted for a viral fever treatment, which is an IV antibiotic treatment. And the boy, just imagine tomorrow, next day is his discharge. So this previous day evening, they are staying near to the hospital only, and his brother-in-law is the attendant for this particular patient. So his brother-in-law told that I'll just go to home and I'll keep certain things there and I'll bring for something, for discharge or something. And he just left. And after 40-45 minutes, this attendant, brother-in-law came back. And he couldn't find the patient inside the room, but the washroom was locked. So obviously he thought that he will be inside the washroom. Okay. And he just waited for another 5 minutes to this patient to come out. But after 5 minutes, he's not coming out, and no sounds is coming from the washroom. So he just knocked and called. No response. Okay. Then he became alert and he called everybody, and parents people came and they just broken the door, and they found the boy, this patient died inside the hospital with a pool of blood, So maybe it happened. He might went to the washroom immediately after his brother-in-law left, and he just locked it also, and he might had a fall. And actually the problem is his backside. This backside of the head is hit against the pipe, and he had a severe bleeding, and nobody came to know, so he lose his life. See, so all these things are very, very important. We are just thinking all these are the silly matters. Nothing will happen. That we have so much prejudices. So just think it's a life. Life is very, very precious. So whatever it is, and ultimately it will be coming, means the person who need to give the justification or explanation is the assigned nurse. So take all these things very, very seriously. Majorly, what you want to do is educate the patient and document it. And if any of the patient is refusing that I don't need a side rail up, I'm not willing to keep it, just get a written note from them. Why you want to take yourself on risk? So ask them to write it. I don't want to keep the side rails as per the hospital policy. And if even after the education get given from the assigned nurse, it's my choice. And if anything is happened, I'll be responsible. Make yourself safe. Okay. And try to keep your patient also safe. Educate them more and more using the professional terms and professional way. So that is about the education. During the admission, we need to educate them. Every day we need to reinforce them, because we know if somebody is just, I'm telling you all these things, how many of you are going to take it very seriously, or how many of you are going to practice it in your daily professional life? I don't know. So every day if somebody is telling, maybe some changes will be there. So same for the patients also. So and they might be disturbed with so much of thoughts also. So daily enforcement and during night shift, because most of the fall just occur during the night time, early morning time. The major reason is many of the patients don't want to disturb anybody in the sense they don't want to call their attendant because they are sleeping. They don't want to call the nurses because they are very busy, as well as let them take some rest. Most of the patients are concerned for this kind of things. So they just try to do the things by themselves without disturbing anybody. So every day during night shift, just reinforce them. that, yes, I'm here. Your safety is my concern. So please don't go by yourself. That will create more problems to us. So please call us. Like that, you have to reinforce them every day. And whenever the patient condition changes, for example, a sedative scheme comes into the treatment plan. So you just educate them that this is the things, this can cause the dizziness to you. So like that, you have to educate the patient continuously, including the attendant. Now, after fall, what? After fall, immediately you have to stabilize the patient. Whoever is witnessing the fall, immediately our responsibility is to stabilize the patient, not run away to call somebody or this, that. Just stabilize the patient. Okay. After that, once the patient is stabilized, check the immediate vitals and all. If patient is deteriorating or something, then report to your charge nurse and report further to the treatment team. And based on that, investigations, CT, whatever they are writing, and whatever references they are giving, like ortho, neuro. So you have to do all these kind of things. Now, incident reporting, you all know. Incident, what is a neomis? Neomis is, just imagine I am just walking down and just had a slip. I didn't fall. So that is a neomis. Incident didn't occur, but yes, it can be. Okay, that is a neomis incident. Now, sorry. Second thing is no harm. No harm is I just had a fall, but I didn't have anything, not even a scratch or anything. So that is a no harm. I just had the incident, but I didn't have any harm. Third one is adverse event. Adverse event is I just had a fall and I may had some scratches or skin peeling or something, minor thing. Or even one or two sutures, whatever it is. That is an adverse event. Incident happened and something happened. And the final one is sentinel event. Sentinel event is something serious is happened. I had a fall and I had a fracture. I had a fall or I had a cerebral hemorrhage. So this kind of serious event, that is a sentinel event. So based on like this only, we are reporting the incidents. So I hope it is clear for you. So now any query, any question, any concern, contact me at any point of time. You all are welcome to ask the questions. So just for a brief, what we went through is IPSG 6, which is the fall prevention protocols. So we just went through the fall, how a fall can happen and what are the preventive measures and what we need to do after a fall. So hope this is clear for you and it will help for your professional life. So thank you so much. See you in another platform. Till then, bye-bye.